Let's talk Cerasee bush. Scientific name, Mamardica gerantia, otherwise called bitter melon extract or bitter melon. It is thought to have antioxidant, anti-inflammatory, antimicrobial, and anti-cancer properties because it contains saponins. The fruit extract or pulp of Cerasee is thought to have the ability to lower the body's blood glucose. In 1999, a study done, 100 people were given, 100 diabetics actually were given this Cerasee bush extract, and they found that the fasting blood glucose and the postprandial, meaning after meal blood glucose levels in 86% of participants actually decreased. Another study was done on rodents, which showed that 4 groups of rodents were given different diets. So group 1, a normal diet, group 2, a high-fat diet, group 3, a high-fat diet, and group 4, a high-fat diet. But group 3 and group 4 were given 250 milligrams and 500 milligrams respectively of Cerasee bush extract. What was found? Surprisingly, despite the fact that groups 2, 3, and 4 were given high-fat diet, group 3 and 4 did not have a change in their body weight. In fact, their food intake did not increase, but their visceral body fat decreased without affecting their energy consumption, thus saying that Cerasee bush could have the potential to even lower body weight. The potential, I'm not saying it does, but it has the potential to do so. They also found that the groups that received 250 milligrams and 500 milligrams of Cerasee bush actually had a decrease in their blood glucose. And this was as a result of insulin sensitivity being increased in persons who received the Cerasee bush. What insulin sensitivity would do, or an increase in insulin sensitivity would achieve, is that less insulin would have to be released for the blood glucose to fall, which is a good thing. Another study was done, which was a randomized control study, where 19 persons were given placebo and 19 people were given extract, 6 milligrams of Cerasee bush, and it was found that the fasting blood glucose was decreased in the group that received the Cerasee bush. However, the HbA1c, which is a measurement of the blood glucose over 3 months, was the same for both groups. So the fasting blood glucose decreased for the group that received the Cerasee bush, but the HbA1c for both groups was the same. It does not come without risks. So if you are trying to get a baby or have a baby, if you're pregnant, I would not advise you to consume Cerasee tea, because what has been found is that it decreases hormones in women, it decreases sperm production in men potentially, and there's also the possibility for spontaneous loss of pregnancy. And this was proven in a research paper where Cerasee bush extract was given to zebrafish embryos, and the results were as previously mentioned. There was spontaneous loss of the embryo, as well as cardiotoxicity and teratogenicity as well too. So err on the side of caution. If in fact, don't drink Cerasee bush if you're pregnant. Okay? If you like this video, please subscribe. Continue to follow, continue to like. If you want to lose weight, continue to type yes below.